Westmoreland Community Connections is a presentation of Citizens Fiber.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Jennifer Miele, Chief Communications Officer and Managing Director of Evangelization of the Diocese of Greensburg.
Hello, and thank you so much for joining Westmoreland Community Connections on WHJB. I'm your host, Jennifer Miele, and it's Heart Month. And of course, no better person to talk to on Heart Month than Dr. Nevin Baker, interventional cardiologist at Excela Health, and structural heart nurse navigator, Amanda Urosek. They're both joining us today. Folks, thank you so much for taking time out of your busy schedules to be with us during Heart Month. We have a lot of wonderful things to talk about, but how are you both? How is life during COVID in healthcare?
Oh, great question to open up with. I'd like to just punt that one to Mandy, let her talk all about that. But so, COVID has changed the way that we practice medicine. COVID has changed the way we're doing procedures in the cath lab as far as safety for those performing the procedures, the doctors, nurses, cath lab staff, for the patients. I would say that since the beginning of the pandemic, we've clearly have an understanding of the coronavirus, the COVID-19, the infection, the cardiovascular impact it has had. And I think that I feel comfortable, and I think speaking on behalf of the rest of my group, that we finally come to a point where we're comfortable taking care of patients with COVID, cardiovascular complications. I would tell patients, and I've been telling my patients, it is safe to go to the hospital if you're sick, if you need care. I think the worst thing to do if you think you're having a cardiovascular complication is actually to sit at home and try to weather it out because you're nervous about the emergency room or what's going to happen inside the hospital. The healthcare facilities at Excela have done a remarkable job of keeping patients safe and still allowing, great care to be done locally. And, I think the more difficult part of this is having patients have a complication from waiting at home with a cardiovascular event, then coming to the hospital and either aborting it suddenly, I'm talking about a heart attack, or developing some complication like heart failure, cardiac arrhythmia, or heart disease going on later on that could have been avoided or treated up front had they come into the hospital. So whether that's having procedures done, whether that's having your doctor wants an echo or a stress test or a monitor, some sort, I think it's okay to have these procedures done at this time.
That is such great advice. And Amanda, I'm sure you're seeing that as a nurse navigator, patients probably calling you and saying, can I put off this procedure or do I need to have it now? And you have to walk them through that process.
Yeah, it's a scary time for patients. It was a scary time for all of us too, just, when it all started. But I think the main thing that I try to drive home with them is that, it's a lot safer at the hospital than it is, going to the grocery store even. We're taking all the necessary precautions and more. We've had thousands of our staff members vaccinated already. We were fortunate to receive those. It's definitely, when it comes to the heart, it's not something you can really wait.
No, that's excellent advice. And I want to start now by asking you both about your backgrounds. Dr. Baker, tell us where you grew up, where you went to school, what you studied, and then we'd probably like to hear a little bit about how you got into interventional cardiology.
Sure. Yeah. Thanks for asking. So, I was actually born in South Carolina. That's just to start way back. I was born in South Carolina. We only spent a few months down there because all of my family was up north around the Erie area. And so I grew up in Erie, Pennsylvania. I went to McDowell High School. I went to Westminster College. Isn't far from this area. Wasn't far from home of Erie. And following college, I went to the Philadelphia College of Osteopathic Medicine for a medical degree, and had spent the next 6 years at Geisinger Medical Center, which is in the center of the state, large medical center that cares for about 3 or 4 million people right in the middle of the state. So the large medical center, did general internal medicine, did general cardiology fellowship there. Actually, is where I met my wife. We had our first child, our daughter, there in I guess it was 2016. I'm sorry, it was 2012. And then following Geisinger, where I did general cardiology, I did a 2-year interventional cardiology fellowship down in Washington, D.C. at the MedStar Washington Hospital Center as part of Georgetown's program. And so it was a 2-year fellowship there. It was part research, part structural, and then interventional cardiology was all wrapped up in that 2-year program. We actually had our found Excela actually after that, and was recruited to come up to Greensburg, Pennsylvania here, back to PA. So we kind of made a big circle around the center of the state, and then back up to Pennsylvania, where I've been here for 6 years. Managed to have another child, another daughter. So now we have a 8-year-old daughter and a soon to be 5-year-old daughter. They're both part of Hemphill School District in town. Locally, we picked up a German Shepherd. He's 1 year old now during the pandemic. It wasn't planned that it was going to be a pandemic, but it was actually the week before everything went on lockdown. We got him. So that's kind of my background, the training. And I think part of the question was what got me interested, if I remember,
Yes.
in interventional cardiology in particular. I always had a fascination with science, I think, anatomy, physiology, cardiac anatomy, physiology the most. I attribute Dr. Foley back in college, actually. I had a physiology advanced AP course, and we did a lot of cardiac anatomy and physiology. Just absolutely loved it. And I also like nephrology, kidney function, and pulmonology. And I felt cardiology, although I enjoyed it the best, also kind of circumference all of the pulmonology, which is lung, nephrology, which is kidney, and cardiac are really intertwined and have a lot of interplay between those two, or between those three. And so I think cardiology was where I felt best suited. And interventional cardiology has a procedural aspect to it, where you're in the catheterization lab, you're doing either working on coronary arteries, peripheral vascular disease, or structural heart, which is the aortic valve, which I think we'll get into and talk about in a little bit. But interventional cardiology has, everything that I feel comfortable working in. It's part of cardiology as a big picture, but it's a procedural based part of general cardiology. And so that's where I feel right at home here in interventional cardiology.
Well, I don't know if the folks at home might remember, but not too long ago, I worked at Excela Health, and I was part of the recruitment team that brought you here to Greensburg, which was fabulous. And
Yeah.
I can't say enough about your personality, your skills, the way that you treat patients is just tremendous. And Excela and Western Pennsylvania is so blessed to have you. And I also fondly remember an interesting story about your smallest daughter. I believe that she came a little early and a little unexpectedly. And although you were interested in the heart and the kidney, I believe that you got some experience as an OB. Is that right?
Yes, unexpectedly. And the last time I had any OB experience was my first rotation as a medical student. I thought I'd left it well in the past, but my second daughter, who will be 5 this Super Bowl Sunday, and it's ironic you bring it up, but this Super Bowl Sunday, Vivian will be 5, and she came roaring into the world 5 years ago during Super Bowl Sunday, about a little after halftime, in our bathroom upstairs in our house. And so we had to quickly get my wife here, and it was actually the nursing staff and our OB at Excela that delivered her. It was Mallory, my wife, got into the hospital, and it was 15 minutes. We hit the ER door, they had her upstairs, and Vivian was there. And that was, I was the only doctor in the room, but I didn't do anything.
Well,
They had it down. I tell you, this was not the first time I think somebody had showed up, ready to go. They knew exactly what to do. To say I was impressed by the OB department here is an understatement. They were incredible. And Vivi was born healthy, no problem. And Mallory, my wife, is high risk. I think I may have told you that. She has congenital heart condition. She had open heart surgery 3 years ago. And so that was the whole reason we were supposed to go down to Pittsburgh and be in a high-risk facility. But no problem from Excela's standpoint on taking care of my family and my daughter, who's healthy and still a wild child.
It's a heartwarming story and perfect for Heart Month to come from a cardiologist. And, we share another commonality there. Vivian is my youngest daughter's name as well. So I never forget her name, and I never forget your daughter's birthday, because I thought it was such a great story. So Mandy, I don't know if you're going to be able to top that one. I don't know if you've ever helped to deliver your own child, but I am very interested in your background, where you grew up, where you went to school, and why you decided to get into this line of work.
Yeah, I've actually was born and raised here in Greensburg. I was born at, it wasn't Excela at the time, but I was born here at Westmoreland Hospital.
Mm-hmm.
Graduated from Greensburg, Salem. I always had an interest in the heart. In high school, wanted to be a heart surgeon, but my mom is a nurse, and I think I got that from her. So I actually graduated from nursing school locally at Westmoreland County Community College. Got my bachelor degree in nursing online, and I'm currently working on my master's online right now, master's in nursing. My background in nursing, I've, in specific to these heart patients, I've worked in CTICU and recovered open heart patients. I've worked in an office with cardiothoracic surgeons. And most recently, before this position that I'm in now, I worked in the cardiac catheterization lab here at Westmoreland.
So you have a tremendous amount of experience to walk people through the procedures that they're about to have. And that nurse navigator position is so important, because people do have so many questions that can't all be answered during an appointment. And I'm sure you find yourself, with that background and that experience, having the ability to walk them through what's about to happen. Is that right?
Yeah, I think, there's a lot of different roles, but emotional support is a big one, and it's very important to me. Education and just coordinating everything for them, trying to make it a little easier, trying to get, the visits here, less, so they're not coming for appointments and testing and things like that. So, but being able to see them full circle, before their procedures, during and after, it's truly rewarding.
Part of the promotion of Heart Month is really to create awareness about heart health and making sure that people know that there are resources available, whether you were born with a heart issue, whether you develop one through adulthood, whether you are still being treated for one. And I think one of the benefits with Excela and the heart program there is the number of locations that people have access to healthcare, which is really important. So Mandy, I'm going to ask you to walk me through that now. There are heart centers and both interventional cardiologists and cardiologists available, I believe, in Norwin, which is North Huntingdon, Excela Square at Norwin, Excela Square at Latrobe, Excela Square at Frick, of course, at the heart of Westmoreland Hospital in Greensburg. And so that access is really important, I would imagine.
Yeah, we're very fortunate. We kind of are able to see the patients, where they are, rather than them having to, go into the city. We're trying to centralize, like I had said, their visits, and for this procedure specifically, TAVR, they need to be seen by a cardiologist, by a surgeon. So being able to do that in one visit for them is really important to us.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of Citizens Fiber.
If you're just joining us, you are listening to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Miele, and I am very happy to have two important guests with me today. Dr. Nevin Baker is an interventional cardiologist at Excela Health, and also Amanda Urosek is a structural heart nurse navigator at Excela Health, and they're here today to talk to us because it is Heart Month. And of course, Valentine's Day, what a more appropriate day to create awareness about heart health. One of the things that I really wanted to dive into today is the new technology that's available at Excela Health. So I'm going to have Dr. Baker, if you wouldn't mind, explain the TAVR and what do people at home need to know about this important advancement in heart care.
If I'm going to discuss TAVR, I think as a treatment option, I want patients, folks that are listening, to understand not only what it is, but what kind of disease process that we're treating here. We're talking about structural heart disease, aortic valve disease, specifically aortic valve stenosis. The aortic valve, as I explained to patients, is the main gatekeeper that allows blood to exit the heart and fill your brain all the way down to your big toes. And this valve, over time and often with age, can become hardened with calcification. I tell patients it's like rust on a car or somewhere on pipes that kind of builds up, and it makes the valve less pliable, makes it stiff, and less likely to open wide and allow the blood to exit the heart. And so when that happens, that's called aortic stenosis. And then aortic stenosis is a process and a gradation that we look at to determine if it's mild, moderate, severe, or even critical with how tight that valve is. And patients that develop aortic stenosis over time often develop symptoms of aortic stenosis. And symptoms of aortic stenosis typically would be fatigue, shortness of breath, sometimes chest discomfort when you're exerting yourself, reduced exercise capacity, meaning you can't do what you used to do 6 months or a year ago. Things take longer. It takes longer to take the garbage out. It takes longer to do the vacuuming around the housework. Some patients with symptomatic aortic stenosis feel chest discomfort with activity, tightness, pressure in the chest. They get dizzy, lightheaded, feel like they might pass out with activity. Those are all signs that that valve, that aortic valve, is stenosed, narrowed to the point where something needs to be done soon to prevent heart failure, to prevent a heart attack, arrhythmia, something along those lines. It's important for patients to know that if you develop symptoms of aortic stenosis, with aortic stenosis, that 50% of patients with severe symptomatic aortic stenosis could die with the disease in as little as 2 years if nothing is done.
Wow.
And so that, if you wrap your head around that, you understand why medicine has advanced to try to help mitigate that the best way it can. Typical treatment for aortic stenosis in the past, and when I say past, it's now been, let's go back 5+ years, up to 10 years, has traditionally been open heart surgery.
Mm-hmm.
Full open heart surgery, aortic valve replacement, and that has been the standard of care. And that in itself has worked, and it's been great for many years. In the last 10 years, there has been advancement, and then we'll get into this TAVR procedure. And I think it's important because patients, the folks that are listening on the radio right now, what I'm talking about with TAVR is an acronym. It's a T as in Tom, A, Apple, V, Victor, R, Roger. So TAVR is an acronym that stands for transcatheter aortic valve replacement. And when TAVR was introduced in the United States, and when it was FDA approved years ago, it was back actually in 2015, it was actually FDA approved. At that time, these TAVR procedures were only being implanted or available either under investigational use, so still under clinical trials in certain patient populations, or were only being approved to be used in patients that were so high risk for surgery that they had no other option. And the TAVR, this transcatheter aortic valve replacement, is a procedure where an interventional cardiologist and a surgeon, a combined team of folks, take a very close watch and a look over patients via a multidisciplinary team approach and decide on the best options and management for a patient that has severe symptomatic aortic stenosis. Our current guidelines recommend that any patient now with symptomatic aortic stenosis be evaluated by a heart valve team, a clinic, for which Mandy is our cornerstone. You know, she's the rock which everything kind of revolves around. But this heart valve team, as I mentioned, is comprised with a interventional cardiologist, cardiothoracic surgeon, general cardiologist at times, and Mandy is the heart valve coordinator that helps coordinate these patients and navigate on which method is best for replacing the aortic valve. And just to take a moment to go back to the idea of the transcatheter aortic valve replacement, the TAVR, very simply, I explain to my patients, is instead of a surgeon doing full open heart surgery, we are now able to place through a catheter, which is typically a piece of tubing or a conduit for which equipment is able to be passed through a blood vessel. We're able to take a valve from outside of the body, put it through the skin into an artery, take it up into the heart where that valve opens up, and replace your valve without having to open up your chest or perform really much in the way of anything invasive on a patient besides a small little hole in a artery in the leg often. And so that has transformed the way we're treating aortic valve disease. And that's a lot. That's a lot of information.
But it's amazing. I mean, you're basically telling me that you no longer have to cut someone's chest open to replace their valve if they're the right candidate for something like this. And so that means a totally different recovery, I would imagine. That means a totally different post-surgical complication list. You know, all of those things with this advancement in medicine. And I'm sure this was quite an investment for Excela too, forming this interdisciplinary team. As well as, investing in the technology. This is wonderful news to hear.
Yep, absolutely. It's, I would say, long time coming, way overdue. The pandemic had set this project back over a year, mostly just the room being ready to have the state-of-the-art room ready to be done to perform this procedure. Ideally, to have this procedure done, you want a hybrid OR room created where you can do everything I want to do as an interventional cardiologist, but you can also do anything you want to do as a surgeon if needed. Mm-hmm. And so that room now exists, and it would have existed a year ago had COVID not happened.
All those complications. So Mandy, your role in this then comes with making sure the patients are evaluated by the team. And I would imagine that there are certain criteria on that evaluation list.
Yeah, as he mentioned, they're being seen by a cardiologist and a surgeon. It's really important to have the full story for the patient so that they can make their own informed decision, that they know all of their options, talking with their families even, which has proven a little difficult with this pandemic, but there's telehealth, there's just even having them on speakerphone during the appointment, just trying to get everybody involved in that patient's life, with their doctors, talking about everything and doing what's best for them, giving them kind of their own hand in their own healthcare and in their own life really is a big part of what I do and why I do it.
Wonderful. So Dr. Baker, when you talk about this kind of technology, do you think it's going to become one of the cornerstones or part of the completion about the heart and cardiovascular care at Excela? Yeah,
absolutely. I think that is going on around the country. I think it's probably every month more information comes out of the medical literature about these type of less invasive ways of treating patients in general, whether it's, doesn't matter if it's coronary cardiovascular disease, structural with the TAVR. We also have the ability now for these Watchman left atrial appendage occlusion devices are being placed in patients that cannot undergo or be on long-term anticoagulation. There's an option now for something that helps to protect patients from stroke, but does not necessitate the need for long-term anticoagulation. That's all part of the structural advances in interventional cardiology and cardiology in general. Specifically, though, with the TAVR, it's been 5 years since the FDA gave the okay to make TAVR an approved alternative to open heart surgery for patients. And again, at that time, it was only for patients that were at exceedingly high risk or could not undergo what they thought at the time would be standard of care with open heart surgery. Still somewhat investigational. Just the following year, 2016, the FDA approved it for folks at intermediate risk. And the idea of risk is based upon a heart surgeon and interventional cardiologist evaluation of a patient, all part of the heart team, to determine risk of operation, full open heart operation. And then that's when I mentioned the risk, how we get to that. That's determined by very meticulous measurements and demographics, medical history, cardiovascular history all play into a patient's risk for open heart surgery. And then we delineate who would be a better candidate perhaps for the TAVR procedure. And now it'll be going on almost 2 years that the FDA gave approval for TAVR in what they consider low operative risk patients. And so the technology of TAVR and the minimally invasive aortic valve replacement is really open to most patients now. And again, any patient now with the aortic stenosis, symptomatic aortic stenosis, ought to be evaluated by the Excela structural heart team, the heart and valve team, and Mandy helps to coordinate that. So we give patients the options, talk about risks, benefits, and alternatives. That's what it's all about, help patients understand what can be done, what might be in the best interest for the short term, long term. A lot of things to consider with TAVR and the new technology. But I think that it's a great thing to have locally. Again, I think it's long overdue. We've had the players in place to be able to do this. We just needed the procedure room to be available to have it done as well. So it's nice that it's all come together. Again, a little bit of a setback with pandemic and the construction, but we're fired up now. We're ready to go.
And patients are receiving this news well, and things are going well. I would imagine you've had some good outcomes.
Yes, yeah. Actually, the first couple of patients that'll have it done here at Westmoreland have been waiting for it. Actually, we've been managing them medically, appropriately so for the time, but they really were excited to not have to make a trip through a tunnel and down into Pittsburgh to have this done. And then the follow-up care. You have to understand that it's not that the valve goes in and then you say, see you later, go back to your cardiologist. You need the structural heart team to continue to follow you. And if you want to be seen on site, fortunately now you can go to any one of the Excela locations to have, kind of follow-up after a procedure like this, rather than having to go down a month afterwards, 3 months, 6 months, a year to be evaluated down in Pittsburgh.
Mandy, if someone does want to make an appointment for an Excela Health cardiologist, how do they do that?
Right now, I've been coordinating all of the visits for TAVR, so they can call me directly. My number is 724-691-5543. And that's a direct number. So it's not, you don't get a machine to press different numbers and, you go off in telephone limbo. It's a direct number, and they can, if I don't answer, they can leave a message and I will get back to them.
Wonderful. And all of this information is also being updated on Excela Health's website, excelahealth.org. And I want to thank so much our team who came on today to talk about Heart Month, because it is February and it is Valentine's Day. No better pair to talk to than Dr. Nevin Baker, an interventional cardiologist at Excela Health, and structural heart nurse navigator Amanda Urosek. You've both been wonderful. Thank you so much for your time. And I look forward to talking to you in about 6 months, and we'll see how those outcomes are going. Thank you.
Thanks,
Thank you.
Jennifer.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.
Westmoreland Community Connections is a presentation of Citizens Fiber.